7:32 now. A Nottinghamshire family dentist has sparked a major health scare following allegations that he didn't properly sterilise instruments and stored some equipment in a staff bathroom.
In what's believed to be the largest recall in NHS history, 22,000 of Desmond de Mello's former patients are being urged to come forward and be tested for blood-borne viruses, including HIV and hepatitis B and C.
Well, Nick Dixon is at a dental surgery in South East London where they follow very strict hygiene procedures, which is, of course, Nick, what we'd expect from all our dentists. So what advice do they have about best practice there?
Morning, Susanna. Well, firstly, the staff have allowed us into the most important room in the entire clinic, the decontamination room. Now, in here, all the instruments are thoroughly clean, not just in the sink, but also in this ultrasonic bath before being moved into the autoclave here, the sterilisation machine, where they use heat, pressure and vacuum as well to clean any bacteria or virus off these instruments. They're then firmly put into these pouches before any of the staff even think about taking them into the surgical area. We're just going to pop round now and have a chat with one of the principal dentists here, just to hear about the standards and the procedures that they have in place. Ali, good morning to you.
Good morning, Nick.
It all looks spotless and shiny this morning, but what are the procedures that you follow in between each patient coming in?
First of all, we make sure that our hands are thoroughly clean, and then we use a fresh pair of gloves, and we make sure that all the areas cleaned and wiped before and after each patient. We make sure that all the instruments are nicely sealed, and we open them in front of the patient.
Okay, and in terms of the patient coming in, what should we be looking for, if anything? What can we see around us to make sure that we're reassured about the hygiene here?
First of all, I would check and see if the dental environmental area are nice and clean and spotless. If I see any flaws, then that will raise some questions. Secondly, you need to trust your dentist. They're all professional and they should follow the rules and procedure. You have got online access as well, so you can see CQC reports, or if your dentist or dental clinic, you're going to our member of British Dental Association Good Practices Scheme, which maintains a high standard. Okay,
thanks for joining us as well. These pouches have an expiry date on them as well. 21 days. If they're not used, they go straight back into the decontamination unit.
All right, Nick, thanks very much indeed. Nick Dixon reporting. If you're a former patient of Mr. de Mello, information from NHS England can be found on our website, itv.com/GMB.